My name is Michelle Lopitolo. I'm from Cheboygan, Michigan, way up north, very tip of Michigan. I was diagnosed with breast cancer December 11, 2015. At the time, you find out you have cancer and you just want to do something now. You want cancer out of you. I had met with a plastic surgeon. My sister, 3 years prior to myself being diagnosed with breast cancer, also had breast cancer, went the implant route. So that's kind of where I went. In the consultation with the plastic surgeon, I did ask him about the DIEP flap procedure, and he kind of just, nah, and just kind of brushed me off. So I did go with the implants. I somewhat immediately felt like I was having some issues. I would go to my oncologist, I would go to my oncology nurse I would see every 3 weeks. I would complain of chronic fatigue, I would complain of joint pain, and they kept telling me they'd never heard of that with the Herceptin infusion that I was taking. So I kept thinking maybe it was my medicine. I stopped my medicine January 4th, 2017 was my last dosage, and I was still having those issues, the chronic fatigue, the joint pain, ringing in my ears. I had horrible anxiety. I would talk to my doctor, my family doctor, and my oncologist about it, and they kept just brushing it off that maybe, who knows what it was. I found PRMA through a DIEP flap support group on Facebook. I decided to go travel to San Antonio because I wanted the best that there was there for breast reconstruction. I did a lot of research. I probably researched over 6 months. So I made the decision to pursue going to San Antonio to PRMA. I think I contacted Brittany in maybe July-ish. Took a little while for my insurance to pre-approve it. And then from there, I was just waiting for my surgery date and then just waiting to get it done. So I'm 1 week out from my surgery. I spent 3 days in the hospital. I've been at home. I feel great. I'm actually going back to Michigan. The day after my DIEP flap procedure, I was amazed at the pain that I did not have in my shoulders any longer that I felt was from my breast implants. So that for me was a huge, huge relief. Something that it was way worth it. I feel whole. I don't feel that cancer has robbed anything from me anymore. I feel whole again. I wish somebody would have told me that DIEP flap was an option. I wish I would have done that first. And then I wouldn't have had to live with implants for 17 months.